Thank you.
Yes. Thank you, Kelly.
The title of our presentation today is Vision, Dental, but No Hearing. Why do employers need a hearing benefit?
And as we get started, I think we'd like to just ask a simple question. Who in the audience knows anyone who suffers from hearing loss? And there will be a poll popping up on your screen shortly, and you can just answer yes or no. And while the poll is coming up, I'd like to point out on the slide here Michelle's contact information, but also if you take note of the toll-free number in the lower left-hand corner, that is the 800 number for the Hear USA call center if anybody is interested in making an appointment for a hearing exam.
I'm sorry, John. Oh, there it goes. Here we go.
Oh, there's the poll. I believe everybody can just click yes or no, and we'll see the results soon. Based on our experience when we were at the conference last, most everybody who came in to the in-person seminar was there, I think, in large part because they did know somebody who suffers from hearing loss. So as I see the results start coming in, it looks like that's the case as well today. So far, 100% of the participants do know somebody with a hearing loss. All right. Well, let's get into the bulk of the presentation. As you can see here, hearing in everyday life, it affects your your relationships. So your emotions are tied to how well you hear, how you interact socially, how that affects you psychologically, and you can see here what we're talking about in this presentation, occupationally as well, because if you can't interact with your colleagues, just like you can't interact with your family members, it could adversely affect not only your home life, but your work life as well. There's some safety issues, and then, a lot of kids get tested, screened in school because it can impact how you learn.
So how do we hear? The capacity of normal hearing, you can hear a whisper to a jet plane, 1 to 1 million. You can hear a rumble to a sizzle.
Now it's actually has a pretty big impact across the nation. As you'll see in this slide here, 32 million Americans suffer from hearing loss. That's about 1 in 10, a little less than 1 in 10. But of that large number, only about 25% of the people who suffer from hearing loss do anything about it.
Fact or myth? Hearing loss affects only old people and is merely a sign of aging. Hearing loss actually affects all age groups. Only 35% of people with hearing loss are older than 64, and this may surprise you.
And what that means is, as an employer, a lot of your employees may in fact suffer from hearing loss. And how it relates to age, a little breakdown, we told you about over 65, but 3 in 10 people over the age of 60, so again, still before retirement age. 1 in 6 baby boomers, again, another demographic within your workforce. The Gen Xers, 29 to 40, so again, employees that could be, currently in your workforce. And then, as I said earlier, the children that are out there being screened in the schools make up 1.4 million of the 32 million who suffer from hearing loss. And then, not all hearing loss is caused due to aging. Some, there's 3 in 1,000 infants are born, so some of it is genetic, but a lot of it is noise-induced or just age-related. As we grow older, we have a harder time hearing.
So the symptoms of hearing loss, and you may have experienced personally with friends or family members or yourself, things that you would notice when someone begins to experience hearing loss is that they're asking others to speak louder and to repeat, or they're not hearing sounds clearly. They're confusing what you're saying, and that goes back to the workforce. If one of your employees is not understanding questions, comments, directions, it can also affect their ability to do their job well, as well as their own personal confidence. They also may show signs of tilting their head, leaning forward, or cupping their hand behind their ear. Also, one of the ones that we probably all have known with older family members is turning that TV or radio to a very, very high volume. They may also report ringing or buzzing or roaring in their ear.
So as an employer, you may be concerned, not only with your employees' the hearing loss, but the other conditions that might be associated with hearing loss. So statistics show that roughly 40% of people who have diabetes suffer from some kind of hearing loss. Now, a lot of people relate diabetes to blindness or problems with their extremities, but your ear is a very small organ that requires a certain amount of blood flow. So if you have these other parts of your body being affected by diabetes, it can also affect hearing as well. Now, dementia is not caused by hearing loss, but there is evidence that shows if you suffer from hearing loss, you're 4 times as likely to end up with dementia. Again, the thinking is that if your brain isn't receiving the stimulation by the lack of sound, that it could help, or it's at least correlation with the onset of dementia. Kidney disease, again, we're talking about blood flow issues, cardiovascular disease, arthritis. So again, a lot of these things coincide with, I think, the thyroid disease. The thyroids develop in the uterus at the same time as the ear. So if you have a thyroid disease, you might be more prone to have symptoms of hearing loss. So when we talk about offering a hearing benefit, it's not just for the hearing, it's also can be tied in as indicators of some other more serious types of illnesses.
Fact or myth? If a person has a hearing loss, his or her primary care physician would tell them. This is a myth. Only 14% of physicians actually routinely screen for hearing loss during a physical. The interesting piece to that I'd like to bring attention to, though, is if you are dealing with a family member that is in some level of denial, sometimes speaking to their primary care physician and asking them to recommend to that patient to get their hearing tested, because they're much more likely to listen to the physician than the family member, unfortunately. So oftentimes then the physician will help that patient to identify and encourage them to move forward.
Now, Price, this is where we're getting into the reason why you're here probably is how is hearing loss, significant in the workplace. The big thing is people lose money when they can't hear. They don't get the proper evaluations at work. They sometimes can be seen as maybe not doing a job well because they can't hear or in turn communicate what they're doing. So studies have shown that people can lose as much as $30,000 annually if they have untreated hearing loss. What that translates to as far as an aggregate, you can see that there's an estimated $176 billion lost in productivity due to untreated hearing loss. That relates into less taxes being collected. And then that people who actually do go and get their hearing loss treated at some point say that it had been affecting them at work. And then because, as everybody knows, your inner ear affects your balance as well as your hearing. Hearing loss also puts you at a greater risk for falling, and that ties back into what we said earlier about it. It's also being a safety issue.
So hearing loss in the workplace, including hearing health and hearing aids as part of a workplace wellness program, encourage workers to treat their hearing loss. Treated hearing loss improves job performance, productivity, safety, and quality of life. And with a workforce that is rapidly maturing, rapidly maturing workers who have valuable experience and expertise, this employer-employee partnership is critical for the bottom line and success.
So that leads to reduced negative effects. So again, everybody here, according to the poll, knows somebody who has suffers from hearing loss. And you've probably, if it's a family member or maybe if it's a colleague, you can understand how stressful that is to deal with somebody who you have a hard time communicating with. So by treating the hearing loss, you can reduce some of that tension and stress. You can make sure that your employees are more engaged and they're not trying to avoid social activities, work-related functions and stuff like that. And then when we've had experiences with people who come in and after they get their first set of hearing aids, they just perk up and they say they can't believe they waited so long and how good they feel. So it can improve your relationships, it can reduce the depression, and again, we keep coming back to it, and as employers, this is, I think, a biggie, is that it can improve their personal safety, from a smoke alarm to somebody hearing a forklift in a factory, just safety all around is improved when you have, when you treat your hearing loss. So before we get into About Hear USA, I'm sorry, Michelle, I'd like to actually put up another poll because we're going to start getting into a little bit about the benefits themselves. So we'd just like to ask everybody in attendance, does your employer currently offer a hearing benefit? Yes, no, or if you don't know, we understand that as well. All right, so we have a little variation so far in these results that I'm seeing. So majority of the respondents are no, which makes sense. We'll tell you why you're here, because you want to learn about how to get a hearing benefit. But it's good to see that at least 25% of the participants do currently have some type of a benefit available to their employees. So thank you for that.
So Hear USA is one of the companies across the country that offers a hearing care network of providers as well as hearing tests and hearing aids. Hear USA itself is URAC accredited, so the first hearing care provider to achieve that, and there are currently only 2 companies across the U.S. that have URAC accreditation. So what does that mean to you, for those of you who don't know what URAC is? URAC is an accreditation board that we are part of. We have to meet certain standards with our equipment, our staffing, our all of the qualifications and insurance requirements that we expect from our providers. We are a trusted provider of hearing services for managed care members for over 27 years. We focus on a patient care clinical model, and all hearing aid recommendations are predicated on the patient's best interest, meaning we don't have our providers picking the most expensive hearing aid just because that has the best result. We have a variety. They, have to look at the patient's needs and their situations and best prescribe the right hearing aid, or if they're not ready, not prescribe one at all, obviously. National network, currently we have over 3,500 providers across the United States in pretty much every state now. We just got one in Alaska, so we're completely national. So if you have employees that travel during the year or that are snowbirds in their retirement, Hear USA is a great option for that service for your employees.
In fact, I think we just opened 3 locations in Canada, so we're actually going international if that applies. As Michelle said, we're a national provider of hearing care, so we like to say we offer value, service, and quality. Previous slide where Michelle talked about how we operate on a clinical model, that means we're not a retail model. So in other words, we're not Costco, we're not some of these hearing franchises where they kind of give the industry a bad name, where it's not just a matter of selling a hearing aid to anybody who walks through the door. We do have that URIC accreditation, and in centers where we have our own employees, we make sure that they treat this as previously indicated as a medical condition. So that's how we provide the high level of service and the quality, and as you'll see on the next few slides where the value comes in.
Mm-hmm. Just going back to that slide for 1 second, just to keep in mind as well as what else is available out there on the market. And you know, when you're looking at a hearing care program for your employees, you want to look at, you know, does your hearing care program provide them with a minimum of 1 to 2, perhaps 3 years of batteries? Do they offer the discount on the full range of products, all levels? As well as whether or not there's a centralized telephone scheduling service. Isn't it nice for your members to be able to call one telephone number no matter where they live to get an appointment and have that scheduled at that time? So those are some of the things that some providers provide across the country and others do not. Not all providers provide a level of insurance that you might be comfortable with, so that goes back to that URAC accreditation. And on to the next slide, John. As a hearing care program, we offer the discounted prices on hearing aids. Members can save 20 to 60% off. So you may hear from employees that, oh my goodness, hearing aids are so expensive. And I've seen prices up as high as $4,000 to $5,000, even $6,000 for one hearing aid, putting that to be quite an investment. If your employer group is part of a hearing care program, you can save a significant amount for your employees, even just on a discount program, as opposed to them walking in off the street and getting retail pricing. There are 5 technology levels from premium on down to entry level with one price per level, meaning that whether your employee lives in Massachusetts, New York, or California, that hearing aid is going to cost that member the same no matter where they buy it. So we have the 5 levels segmented for each type, and you'll see a slide in the future that tells you a little bit more about what each level is for the hearing aid choices. We have a variety of manufacturers from which to choose from. We just added Starkey and Oticon. We have Siemens. We have a variety of hearing aids. I think pretty soon we'll have the largest number of hearing aid manufacturers to select from across the country. And we offer a 3-year manufacturer's warranty, including loss and damage with our program for our employer group. The loss and damage has a small, if they lose their hearing aid, it has a small copay to replace that within the first 1 year. And there's a 1-year supply of batteries that's provided to the patient at no charge. We at Hear USA also offer a full 1-year option of being able to go into the provider and get their hearing aids adjusted for no additional charge. We feel this is very, very important for our patients to not have a limit on how many times that they can be seen. We don't want that hearing aid in the drawer that ends up being most expensive hearing aid is the one that someone doesn't use. And we have a hearingshop.com that provides accessories, continued purchase of batteries, hearing dry and store kits, and even TV ears and that sort of thing. So with our special programs, they get a discount on that hearing shop.
And going back to that 1 year of unlimited follow-ups, that speaks again to our clinical model. It's not just enough to sell somebody a hearing aid, slap it on their ear, and send them on their way. Especially a first-time wearer of hearing aids, they're going to need a little bit more support, getting used to hearing sounds they haven't heard in a while, as well as just these are pretty complex devices. Just learning how to work all the features may require some additional visits back to the provider. Here's the fee schedule Michelle is working to, and you might have a question as to why are there 6 lines when we said there's 5 categories. Our pricing is typically $995 to $2,500, but due to the demands of some of the consumers and some of the health plans that we work with, and in order to achieve that 60% savings, there is a very limited number of hearing aids at the base that are even kind of less than the basic technology, which we call entry level, that we can sell for $495. Now, that being said, that hearing aid is probably not going to suit most of your employees. That's, again, very low technology, typically worn by people who are just sitting around, having one-on-one conversations, maybe watching a little bit of TV. But that is out there. It is available for the small segment of the population who would benefit from that particular price point.
So this slide here is a little bit busy, but it provides a lot of valuable information. So I'd like to walk you through this so that you understand what exactly is being presented to your employees when they go in for a hearing evaluation. If they are identified as having a hearing loss, then the provider starts to begin to question that member as to what their environment, what their life is really like. Are they having, as John said, just one-on-one conversations, watching TV? You might think of maybe someone who's in a nursing home that may be adequate for. But if they're involved in a lot of small group conversations, then they really need to go up to that value level of hearing aids that has some feedback reduction, some noise reduction, directional microphones, and it offers 3 to 5 channels for frequency variation. From there, you go on up to the mid-level, and that one is $1,600. It increases to up to 9 channels, and you add like lectures and they say religious services, but large group attendance, right? And these 2 categories, I'll stop here just to say that a lot of employer groups will provide, say, a $1,500 benefit that they would cover, and it gives the member the option to stay within their benefit of $1,500 for their hearing aid by choosing a value hearing aid, or taking some money out of pocket perhaps and going up the levels so that they could get maybe more features or more background variation. If you go on up to the advanced level, the $1,995 level, now you begin technology that includes more of a public place environment, continuing to work with those directional microphones, and also adding some additional features that they may use, some technology that they may be using, such as Bluetooth, et cetera. And then you go on up to the premium levels, and the newest hearing aid, which actually, as far as Hear USA and the Siemens brand, they just released a very high-level hearing aid called the Binax that has some amazing capabilities, including 360-degree hearing. So if someone's standing behind you, if you have someone who's working in food service and they're dealing with people behind them and in front of them and to the side of them, giving them directions, this really could be an excellent choice for them, because they're definitely able to help decipher all of those various situations that they may be in, as well as large performances, events, those sorts of things. So as you can see, not only do the channels go up, or the ability to differentiate different sounds and more sounds as they go up, they also add more technology capabilities. If I'm in my position, I would definitely want to choose the premium level, and more than likely the Binax level, and being able to change the volume from my cell phone when I'm sitting in a room, instead of having to reach behind my ear, which may cause me some embarrassment. So when you're working off of your multiple devices, you have a lot more privacy and autonomy, which means a lot to a lot of employees.
So you saw what the costs were for the hearing aids themselves, but how would that cost translate to an employer? And that really kind of depends on how much of the cost the employer wants to take on. Michelle said earlier, if you just want to get your feet wet and just have a discount program that you offer to your employees, that'll cost the employer nothing. Your employees would pay fully out of pocket for the prices that you just saw. And again, like, it could be just an introduction into hearing health, and we can provide educational materials and things like that to make your employees aware of the savings, the potential savings that are out there. But we can also design something that meets your budget. Now, Medicare Advantage, the most common Medicare Advantage plan, again, you're talking seniors, offers a $500 benefit per ear. So going back to the previous slide, if you remember that $500, that would come off of all those prices, and then they'd be responsible for the remainder of that. But as Michelle indicated before, hearing aids are a vanity issue. A lot of times people don't want to acknowledge that they're getting older. They think that the hearing aid is the classic signal of that. Vanity plays a lot into it. So even the seniors who have a benefit, have some level of benefit, and are in that older demographic, only, it should say 15 and 1,000. I apologize for the slide being wrong. Only 15 seniors out of 1,000 will actually go in and purchase hearing aids. So, for example, if you have 500 employees, that's at the senior rate, that's going to be, 7 or 8 people might go in and get hearing aids. So, again, if you're offering a benefit, we can kind of help you do the math to figure out what that would cost you. What's the utilization rate going to be? And I'm sure if we have HR people on the line here, you probably know what you're paying to offer a dental or a vision plan. And I can almost guarantee you that when we crunch the numbers and look at what it would cost to offer a hearing benefit, it's going to be cheaper than what you're currently paying for dental or vision.
Additional advantages with a hearing care program like Hear USA, we offer a centralized telephone number to contact to make those appointments, as I mentioned earlier, and the program is simple and transparent for the plan and the plan administrators and the members. So if the plan has a benefit, we can bill the plan for that portion, and then we bill the member for the difference at the location. And if there's just a discount only, then when the member gets to the provider, that provider already knows what their benefit is and what their options are if they should need a hearing aid after they've completed their hearing exam. We offer educational information to every member, and we also offer measured performance to our employer groups. So in other words, we can send you a report that lets you know how many members made appointments, how many members under your plan utilized or actually got a hearing aid, and give you that feedback so you know what your utilization is.
And with that, we just like to thank everybody for participating. We will be following up with the slides. I'll make a correction to the one that I indicated about the utilization. but we'll make the slides available to all the participants today. I think we can
And if
open it up,
anyone,
Kelly, now for questions.
questions? I guess I would like to add one thing is that if anyone is interested in being auto-enrolled in our discount-only program to start with, if you can identify yourselves in your question section and let Kelly know, she'll let us know that we can do a customized website for your employer group that you can send out by email to all of your employees where they can look up where their closest center is. It has the 800 number, and it would offer them that fixed pricing. If you'd like to do a benefited program or an ASO model where you pay per member, those are also things that we at Here USA are able to do, as well as some of the other companies across the country. We would hope that you would select Here USA, but you're welcome to do your homework and get back to us. Any questions
So I
from
believe,
anyone?
I believe Kelly's monitoring the question and answer box. So if there's any questions out there, Kelly, could you read them off?
I've got one so far, and it is just basically what's the implementation timeline. So I guess my question for you could be twofold. If they're interested in just the discount program, what's the implementation timeline for you making the customized website? And then if they're interested in the actual benefit, what's the timeline on that as well?
Well, the custom landing page and just the straight discount, Michelle's called it auto-enrolling your members, it could be done within about a week. We would just have to exchange some basic information, provide you with the link, and then you would send it out to the employees, and all we'd have to do is let our call center know what the name of the employer is and how the members will be identifying themselves, and they would automatically get that discount pricing. As far as implementing some sort of a benefit, that's usually about a 90-day rollout. We'd have to exchange some information as far as how to submit the claims, work out some customer service details and things like that. But it's usually about 90 days from start to finish.
I guess that I would like to add that I'm not sure if we fully went through that earlier, but another benefit of using a company like Here USA versus someone, a variety of local providers is that you have one central point for payment and billing, and so we can handle any billing and payment at our one central location in Florida, which is where our corporate office is. We also offer financing, 1 year, 0 interest for your members.
Okay, another question that we have had come through is, what is the cost of the hearing exam?
Well, the hearing exam, that's negotiable. Typically, we structure that around how many employees you have, but at most it would be $45. Oftentimes we can build it into the program where we don't charge the employee if the employer is going to cover it. Then we can charge the employer a little bit less. But if you're just going to have a discount program and members paying out of pocket, we limit the cost of the exam to $45. And some providers in our network actually don't charge. So that's something as well. If the member calls in and they say, well, I really want to find a provider that does not charge for the exam, our call center agents have an indicator, and they can say, well, here's the 3 closest providers, but the closest one charges, and the guy that's 5 miles or 10 miles away offers it for free, and then the member would have the ability to choose which provider they go to. Anything else?
Okay. Well, I don't know if we've got any other questions coming in at this time. Thank you, John and Michelle, for all this wonderful information, and thank you, audience, for joining us today. Please be sure to check out our website for future webinars, and we invite you to join us at a conference. Next week in Chicago might be too soon, but we have San Antonio coming up in September. We hope to see everyone there. as soon as we end the meeting, please take a moment to complete the brief survey that's going to pop up on your screen, and we will send you credit information and the link for the recording tomorrow. And John and Michelle will be in touch with the slides as well. John and Michelle?
Thank you, everybody.
Thank you, everyone.
Okay,
Have a
thank